I want to stick with the latest on COVID and the vaccine push and welcome in Dr. Manish Garg, emergency medicine physician and co-founder of World Academic Council of Emergency Medicine. Dr. Garg, always good to see you. So, you just saw Alexis rattle off all of those measures that municipalities are taking, that private companies are taking. When you look at these new recommendations now from the CDC, in hindsight, did we reopen our economy a little too quickly?
So thank you, Alexis, and thank you, Kristen, for having me back on the show. Great to see you again. Just for transparency purposes, the thoughts are my own, and I have no conflicts of interest with pharmaceutical industries or vaccine developers. Yes, Alexis, to answer your question, I believe that the recommendations that were made originally were appropriate because as this virus has evolved, so must our public health recommendations. And previously, when we had the Alpha variant, which is the variant that came from the United Kingdom originally, that was not shown to have transmission once you've been vaccinated. Now, the Delta variant is showing that you have transmission once you've been vaccinated. And when we look at the CDC map that was just shown, it's showing that about 2/3 of the counties of this country are in either what's called the high or the substantial region of transmission risk. So that is a real big concern. And I think that the current recommendations follow one, global health recommendations like WHO, two, shared experience. So I can personally speak as a physician who's been working in 3 different hospitals in New York City. I'm seeing a number of breakthrough infections happening, not just in patients, but in my colleagues. And you can imagine my colleagues are the ones who are probably protecting themselves the most. Now, these breakthrough infections are not leading to deaths, are not leading to intubations or ICU stays, but that's where the vaccines protect us. But it's important to know that when you follow science, the science is clear that the masks work, vaccines work, and we need to evolve our public health recommendations as this virus evolves.
Doctor, what about booster shots and perhaps even that third vaccine shot? One, we are seeing Americans out there that are choosing to try to mix and match essentially vaccines. So on the flip side, we have folks refusing to get vaccinated. And then on the other, those that are apparently just driving around trying to get extra shots. Is this something that folks should attempt to try to get an extra shot? Or do you think that booster shots are absolutely needed, at least by the fall?
So this is a really complicated question, Kristen. I would say that boosters are going to be necessarily for those that are the most vulnerable. So those who are either immune suppressed or immunocompromised. And I think that that's where we're going to see this eventually go. Right now, we know that if you've been vaccinated with any of the vaccines that are currently available in the United States, so the Pfizer, the Moderna, the J&J, you are going to be protected from the worst possible outcome, which is the intubation, ICU admit, death. And I think that's the key point here. But as we all know, this virus still does a number on people who've been infected and have even a breakthrough. So we are seeing that this has become a pandemic of the unvaccinated. And there's a large chunk of people that are still unvaccinated. And unfortunately, in that group, they need to take all the precautions necessary. We know that the boosters, we know the vaccines, if you do mix and match, they do work, although obviously at this point that's not being recommended. So I think in the fall, as we start to, hopefully we'll get clear evidence for the big swath of people that are unvaccinated, which are the children that are under 12. Hopefully they will get, the data will be there that they can get vaccinated, and then they will be, and we will be looking at a much better experience. But right now, as we continue to develop more variants internationally and as they come our way, it looks like boosters are going to become a reality.
Doctor, there have been some critics, even in the medical world, about vaccinating the very young, those under 12, saying that it's not a move we should make since the virus doesn't seem to affect them in really bad ways, meaning there are very few hospitalizations and very, very few deaths. What would you say to those people who say they should take precautions but should not be vaccinated?
Yeah, this, Alexis, is a great question because right now we do know that children that are under the age of 12 are having, they seem to, when infected, seem to not have the worst outcomes. But right now, over 20% of the infections that are happening in the unvaccinated are children. And so, unfortunately, children may end up becoming the folks that are spreading it to those who are the most vulnerable in our communities. And, right now, we all have different bubbles. We all have different people within our household that may have a different type of immune risk. So if you have somebody who is immune compromised, somebody who's immune suppressed, your child might not have a severe response to the COVID, but your loved one might, the one who's not protected might. So I think you have to look at this as a public health measure and say that we're trying to protect our most vulnerable, and we don't want children to be the vectors of that. I don't disagree with folks that are saying that children have very little outcomes and that it could be worse driving in your car than it would be for your child to get infected. But the virus is still novel. We don't have long-term data on what happens to children if they do get coronavirus. We know that you can get multi-inflammatory syndrome in children, and we certainly don't know the long-term effects if kids do have a bad outcome. So, I think it all depends on what a person or family's personal risk is. And if you have children that certainly are at risk, or if you have people in your household that are there, it makes a lot of sense that people would end up trying to use a strategy that would protect all of us.
All right, we're going to have to leave it there. Dr. Manish Garg, thank you so much for being with us.